Hello, my name is Josh Covington. I'm a physician assistant in Orthopedic Spinal Surgery. My extended family and my father all worked in the steel mill, and I chose the same path initially. I was a pipe welder and a mechanical repairman, and the steel company closed down, and they offered retraining, and one of the retrainings was as a respiratory therapist. And as a respiratory therapist, everything I learned was similar. So pumps, pneumatics, hydraulics, electrical all seemed to fit into human physiology, and it was just an easy fit. And from there, being a respiratory therapist, I found the field limited and decided to go to PA school, which was a wonderful choice for me. I decided to choose orthopedics and the surgical field because I very much like to work with my hands, similar to when I worked in the steel industry. And my first job I landed was at Intermountain Spine Institute in Salt Lake City, Utah. I fell in love and had a passion for spinal medicine and have continued over the last 17 years. I think my greatest asset is actually my ability to communicate with patients and build a rapport, which I overall feel is the most important part in medicine. For them to feel comfortable with everything that we're discussing, to be able to educate them. Spinal conditions tend to be a long-term disorder, and being able to educate a patient with how to independently care for themselves is usually my primary goal. In spinal medicine, I find the most aspects are rewarding is every day is challenging. Every patient is different, every condition is different. The variety is wonderful, and I get to do a lot of extensive non-surgical care as well. So I spend a lot of time education with patients and treating elements that are not surgical, which I enjoy as much as the surgery aspects. Most of my time has been taken up with family activities, which I enjoy the most, and I also enjoy being outdoors. But from a professional standpoint, my kids are finally teenagers, so that affords me the opportunity to explore more boundaries. And so now I get to participate in community medicine events. This year, actually, I'll be traveling to Africa to participate in a spine surgery teaching event.